Let's clear the air. The bottleneck causing claims to stack up in your revenue cycle is not Office Alley. Office Alley is a highly capable platform trusted by over 80,000 healthcare organizations. The software works. The problem is the queue inside of it. A capable EMR still requires rapid, precise human intervention to move claims, spot errors, and work denials before deadlines expire. We can see the symptoms of this stagnation in these diverging trend lines. 41% of providers now see denial rates exceeding 10% of all claims. At the same time, 90% of medical groups report higher operating costs, driven largely by labor. The volume is going up, and the cost is accelerating. The math is unforgiving. When claims slow down and denials pile up, you aren't dealing with a technology failure. You are dealing with a severe human capacity shortage. Healthcare billing has always been complex, but the current pressure on in-house billing teams is stretching operational support roles to their breaking point. The annual turnover rate for support staff is 33.3%. 1 out of 3 billing team members leaves every year, creating an endless rehiring loop. The financial penalty is heavy. Replacing a single biller costs between $25,000 and $30,000, and that replacement doesn't hit the ground running. Office Alley has specific workflows for payer enrollment, clearinghouse settings, and denial tracking. Even a highly competent generalist biller requires 60 to 90 days to learn this specific architecture. During those months, claims sit. Watch this block representing total denied claims. Because new staff are overwhelmed learning the system and processing live queues, up to 65% of denials are completely abandoned. The revenue dissolves into nothing because the team lacks bandwidth to appeal. When you combine a workforce that turns over every 3 years with $30,000 replacement fees and the abandonment of the majority of your denied claims, the traditional in-house billing model becomes financially unsustainable. Solving this requires stepping off the treadmill of hiring generalists. Practices are fixing the bottleneck by deploying teams that are already credentialed on the platform from day one. Staffingly's dedicated Office Alley medical billing services provides AAPC and HFMA credentialed specialists. These are not generic temporary workers. They operate inside your specific EMR workflow every day. Their primary target is a 90% clean claim rate, meaning 9 out of 10 claims process perfectly without manual intervention. They achieve this because they know exactly how to execute payer-specific workflows using Office Alley's exact configurations. When you assign consistent, highly trained specialists to work the same payer contracts week after week, they develop operational pattern recognition. The learning curve vanishes, and because they already know the software, deployment is fast. From the initial kickoff call mapping your workflows to securing platform access, the team goes live in exactly 14 days. This funnel illustrates the technological advantage they bring: AI-augmented claim scrubbing. Before a batch is ever submitted, automated tools scan the data, actively separating documentation gaps and coding mismatches before they can generate downstream denials. Only 14% of providers currently use AI to reduce denials, but within that small group, 69% report fewer rejections and higher resubmission success. Giving a credentialed human reviewer a pre-screened queue powered by AI directly addresses the root cause of denials. You get enterprise-level accuracy without having to change your core EMR. When we compare the costs on this scale, the choice becomes obvious. A single in-house employee carries fully loaded expenses of $55,000 to $75,000 a year. Staffingly's dedicated support starts at a predictable $399 per week. There is zero long-term commitment risk. The service operates month to month, allowing you to scale your bandwidth up or down with just 30 days' notice as your claim volume changes. Compliance and visibility are built in. Operations are secured by SOC 2 Type 2, ISO 27001, and HITRUST certifications. And this CFO-ready dashboard delivers weekly performance reports on throughput, accuracy, and turnaround times. By replacing an unstable internal workforce with a scalable, credentialed team, you remove the operational friction. Office Alley stops being a bottleneck and operates exactly as intended, as a highly efficient, high-performance profit engine. It is time to end the staffing spiral. Start your 14-day risk-free pilot with Staffingly today and reclaim the revenue your practice has already